There's emerging evidence that manual stimulation of tissues can stimulate bone growth. So for the face, this means that massage can help you maintain your bone structure over time. This is one of the main things that happens as we age. Our bones shift, they change, and our body pulls from our bones. It's no longer laying down new bone, because your bones are actually growing all the time. So of course we're not going to grow an extra layer on our cheekbone just by massaging it. You're not going to change your bone structure necessarily. What you are going to do is provide your body the best environment to maintain that bone over time through the natural bone regeneration process that is always occurring. So I said there's evidence on this. There is, but there's not enough for us to say conclusively. So in my opinion, what's it going to hurt? You're going to release tension, you're going to improve the health of your tissues, and I think there is enough evidence to say that this can help support your body's bone growth process, like I said. So one of the main areas is going to be your eye socket, your orbital bone here. This is what causes a lot of changes in our eyes, and that affects not just the look of your eyes, it also affects the function of your eyes. It can create things like Maller bags, edema, it can affect the watering of your eyes, your eyesight, so we want to maintain this bone structure and support as much as we can. So this is one of my favorite techniques for working on the bones of the eyes. So we're going to take our two knuckles like this. We're going to put our knuckles on our orbital bone, on that rim. So you're gonna feel how it has like a ledge, and you're just going to position your knuckle where the ledge is about right here. So underneath the main knuckle here. And once you have that, just adjust even slightly as needed to fit your natural facial structure, your own unique anatomy, so that it lays nice and flat onto that ridge, and we're not tugging the eye skin. We're just pressing in with medium pressure, which is where you're not pushing hard, you're not getting a lot of muscle in there behind the push, but you're not just lightly on the surface either. And then you're just gonna let it be here for at least 30 seconds. And you can even use a tabletop and lean your head over, or you can rest your arms on your body and lean over like that. There's a lot going on here. There's the eye muscles, there's connective tissue, and it can feel quite sensitive if you tend to wince your eyes a lot, if you have a lot of wincing eye tension. And final step, you are going to vibrate in place after you have held for a while and you feel like some of that tension has dissipated in this area. So this is really great for stimulating the tissues and structures of this area. We're not pulling across the skin, we're just moving in place to stimulate and provide movement. And lastly, you can also take your knuckle like this and you can work right on that rim very carefully, medium pressure again, and you can hold the skin to stabilize everything here. And you just work in these little tiny scraping motions across that bone, and you're going to feel the variations there. Those are normal, they're not going away, but just work across them, stimulating the tissues and the bones underneath.